Welcome to Pittsburgh Earth Days, the Dirt Podcast, featuring Grant Ervin, live from the Point Park University Center for Media Innovation. Here is your host, Grant Ervin.
Hello, and welcome to the Dirt Podcast. I'm your host, Grant Ervin, the Director of Environmental, Social Governance, and Innovation for S&B USA. A new host, new sponsor for the Dirt Podcast here. S&B USA is a leading provider of sustainable and resilient infrastructure and construction solutions in the areas of renewable energy, transportation, and industrial systems, as well as ports and waterways and vehicle electrification. We're excited to be a new sponsor for the Earth Day podcast, and I'm proud to be here with you all today and have a great guest. And before I talk about our guest, or I don't want to talk about it, we'll talk with our guest. One of the big things that we wanted to introduce as a part of the Dirt podcast and our conversations related to ESG, or environmental, social, and governance topics, is the S in ESG, and so the social side. And so today we have Ray Prushnok with us, and Ray is the Executive Director of the UPMC Health Plan's Center for Social Impact. Ray, how are you today?
Great. How are you doing, Grant?
I'm doing terrific. Getting used to a new intro to the podcast here. So you're a little bit of my guinea pig, but a lot of great topics and information for us to cut through today. So maybe just to start off for our listeners, talk a little bit about Ray Prushnok and your journey into the role that you have today with UPMC.
Great. Thanks, Grant. And thanks for the opportunity to be here. So I've been with UPMC Health Plan for about 11 years. So I started my career journey working for an environmental organization doing consumer issue-related work, working on issues around predatory lending and other consumer issues in Albuquerque, New Mexico. And that led me on a path to state government, where I was able to work on issues concerning long-term care and aging during the Rendell administration, and really introduced me to Medicaid. And in the past 11 years, I've been first starting off on really more the business side of health insurance. So I was working in our dual eligible special needs plan, which serves older adults, people with disabilities. Went on to help create our long-term care plan called Community Health Choices. And for the last 2.5 or 3 years or so, I've been working on setting forth on this new path around our UPMC Center for Social Impact.
That's excellent. So,
I'm sorry, can you move the microphone a little?
Sure. All right. How's that?
Yeah, that's good.
Okay.
Yeah.
Perfect. So a journey from Harrisburg back to Pittsburgh. Is Pittsburgh home for you?
Well, I grew up in Punxsutawney, Pennsylvania, so home of the groundhog.
Home of the groundhog. So you're also a part-time weather prognosticator as well?
Well, we leave that to the professionals. So Phil, I don't want to step in front of Phil, but yeah, it's definitely a point of pride for myself and my hometown, and have had friends and family in the inner circle. So
in the inner circle,
yeah.
All right, that's good to know. Now 1 degree of separation away from Punxsutawney Phil. Ray, maybe to dive a little deeper, tell us about the Center for Social Impact, and both about kind of the work, but also some of the origins, maybe.
Sure. So first, I guess, is a backdrop. UPMC Health Plan, we have over 4 million members. We, serve, a variety of people across every line of business, whether it's meeting your business's needs or individual needs, but we're also a large insurer in the government-sponsored space. So we are the largest provider for health insurance for people with Medicaid, with about 550,000 members, concentrated mostly on the western side of the state. Mm-hmm. We serve 135,000 members in our long-term care and dual eligible product, also all individuals with Medicaid. And we have 40,000 members in our dual eligible SNP, which are people who are older adults or with disabilities on Medicare who also have Medicaid. And so working on the business side of the house, serving mostly those government products, we always had a variety of things that were intended to really help do well by doing good, innovate, and really try to think outside of the box to meet really what have become known as the social determinants of health. Mm-hmm. So Say back 12 years ago, we began a program to support members experiencing homelessness, a partnership with Community Human Services here in the city. Mm-hmm. And that program had, I don't know, about 20 members or so in it at any given time, and sort of working with those individuals around supportive housing. But it never really sort of blossomed and grew until we started a Center for Social Impact in order to really focus in on some of these initiatives. So we've now grown that program where we're serving about 70 people today. We've now expanded into 2 new counties where we're looking to see some growth. So that's just one example. And similarly, we had a variety of other things, whether it was helping members with their employment needs, or helping people get connected to public benefits, or other types of connections between human services and insurance. So in order to really confront those issues, we decided in 2019 that it was important to have a department that could be solely focused and really help align other parts of the business around how we meet social needs.
That's interesting. So maybe take a deeper step back, like talk about the origins of the health plan itself. I think that's also kind of interesting to fast forward, because when we think about UPMC, I think oftentimes folks are thinking about the physical healthcare applications. I'm going to the doctor, I'm going to the hospital, or emergency services, or surgery. But the health plan is a unique kind of animal within the broader UPMC family. Maybe talk a little bit about that.
Yeah, absolutely. I think one of the things that really sets UPMC apart is our focus as a payer and a provider. And it makes a big difference when you're thinking about moving away from volume and towards value, and being able to think about what is the right thing you can do for an individual person to improve their health, and changing the incentive structure. So we hear a lot about value-based care in the healthcare arena, but really what that comes down to is how do you make sure that doctors are incentivized to focus on health. And so as a payer and a provider, it's not about pushing volume to expensive services. It's about helping that person get what they need. And so that doesn't sort of tie the system to revenue, and helps the health plan really be able to influence health. And we, in many ways, sort of the old days of taking a premium, paying claims, and providing a network are things that everyone can do.
Right.
What sets an organization like ours apart is our ability to design value-based programs that help create these types of incentives, and to go beyond in these areas like health-related social needs. So if we have a member that is unable to get to a physician's appointment, what are things that we can do to provide transportation, right? Or if there's a member that is having trouble financially, or is unable to see how they're going to have food for their family at the end of the week, they're going to have a hard time focusing in on their health plan, calling them for whatever screening or appointment they might need. So there's been a broader recognition as we've seen quality improve. It hasn't improved necessarily equitably. And so since the Affordable Care Act, there's been a lot of energy put into quality improvement, and we've seen the results. Readmission rates are down. We have more people with insurance than we have ever in our nation's history. We, in some ways, are seeing quality improvement on the traditional HEDIS measures and otherwise, but still there are persistent disparities. So
Can you talk about HEDIS measures? That's a new term for me.
I'm sorry. So it's a standard set of measures around quality. So things like making sure that a certain number of members aren't readmitting or filling prescriptions or hitting the sort of necessary checkpoints. So
interesting. So you guys get to see that holistic picture then of, in many cases for us, our region's health. What are some of the insights that you glean from that, in both in seeing that quality improve, but also some of the challenges that exist currently?
Yeah, so I think at large, I mean, we're very fortunate to have such world-class medicine here in the region. UPMC is proudly, advancing that agenda with, I think the number's $800 million of new capital investment into new facilities and technologies, and and some of the remarkable things happening with, the UPMC Vision Institute and the creation of the new, tower at Mercy. And, there's really state-of-the-art medicine happening, and, really personalized medicine and looking deeper into how, the genetic code influences outcomes. But, with my work, we're able to, look a little differently and say, okay, we see persistent disparities in neighborhoods. And so our leadership team is really focused in on how our department can work collaboratively with the system to help, close some of those disparities by addressing health-related social needs.
That's interesting. I'm going to go a little out of order here. I mean, we talked a little bit, and you mentioned it earlier, about the social determinants of health, and as being, one of the critical frameworks that guides the work that you all do, both as, the healthcare services, but also through the health plan and directly through your center. Maybe talk about what are the social determinants of health, and then how does that guide kind of the work that you all are providing?
Sure. So within this discussion, I think there's just a plain acknowledgement that most of health and health outcomes occurs outside of a doctor's office. Mm-hmm. So if we think about 10 or 20% of health outcomes and mortality are, associated with the types of clinical care you're receiving, the vast majority of those outcomes are going to be tied to the genetic code, your environment, your zip code. Yeah. So within that, so thinking about some of those things that are impactable. Mm-hmm. So we can't necessarily impact your genetics. We can, as a society, look at some of the environmental issues, and I think on the sort of Earth Day focus of the DIRT podcast, there are things that we as an organization can do to help improve community health. It's been a priority for us charitably for a long time, but it's also a little more difficult to improve the environment for one member at a time. Mm-hmm. It's a bigger lift for society, but for some of these social needs, that's where we can have an impact.
Awesome.
And so that's where we're really focused in. So if we have a member experiencing homelessness, how do we get them connected to housing?
Right.
If we have someone that's rent burdened, as one of my colleagues says, the rent eats first. Mm-hmm. So you're not going to engage somebody on getting that colonoscopy if they have other issues that are sort of eating up their attention and time. So there's there's an increasing acknowledgement that we can't just simply expect by getting people to a primary care physician or getting them into preventive care or just breaking through to somebody that's unreachable, that we can't do that work unless we're helping to address some of the barriers that exist. And those barriers could be financial, they could be transportation, they could be education, they could be finding a job.
Yep.
So we're trying to work on each of those fronts in order to help improve community health.
Interesting. So just to play that back a little bit, you're looking at employment, workforce development as being a critical factor. You're looking at housing as being a critical factor, education, another kind of core component, and then the built environment and the community context in which health plan members live and reside and work and play in, right? So it's that total picture all of a sudden becomes just as important as going to your personal physician, or I got a pain in my shoulder or something in my stomach. There's other factors than actually that's what's going on in your physical body, right?
Yeah, that's right. And I think that's where our team comes in. We're looking to see where we can demonstrate that impact. So some of these areas are just the right thing to do. That's in where we've made commitments charitably. So UPMC is known for its commitment to the Pittsburgh Promise, for example, to help advance education here in our region. Similarly, we from a charitable standpoint, heavily invested in environment. We have many of our executives engaged in board service and focused in on the environmental community. But for some of these other areas, like health-related social needs, housing, that's where we can begin to see moving from charity to impact. And I think that's where that sort of ESG conversation comes in, right? So like how are we as a corporate citizen, we're always going to be able to do some things that, can happen charitably, but that has a limitation. And so where can we begin to do things that add value and be able to do more? So for example, supportive housing for people experiencing homelessness, we've been able to demonstrate it takes time, it takes significant investment, but after about 10 months, we begin to see that cost curve bend as people begin to get into more preventive services.
It's interesting. We've both been a part of this in some of the same spaces and different spaces. One of the things that I've seen is this move where several years ago there was a lot of that conversation around corporate social responsibility, which wasn't a nice to have, it was a need to have. But many times that's the philanthropy, like you said. That's we're making a donation to fill in the blank X organization. All very important and critical things because it gets a company involved in the community and gets a better sense and feel of who those players are and the different dots that get connected. What have you seen, though, maybe over the last 3 to 5 years, maybe it's been even shorter in that, where there's been a pivot where we've elevated ourselves from just CSR now into this ESG conversation where you're looking at impact, right? What was there a pivotal moment for UPMC in that sense, like whether it's the genesis of the center or is there something that just kind of clicked, I guess, or was it more of an evolution over time?
I think it's certainly been an evolution over time, but it's in part it's in our DNA. We are an organization that's always cared deeply about its community, and in terms of serving our communities by providing outstanding patient care, that can only be a part of it. A part of our sort of corporate vision that always stands out to me is that by putting our patients, health plan members, employees, community at the center of what we do, we build a model that ensures every patient gets the right care in the right way at the right time every time. We can't deliver on that if we're not thinking about some of these broader societal issues. And that's where as a part of our Center for Social Impact, we're focused in on how do we help people meet basic needs. We've found great success in just helping individuals get connected to public programs that they qualify for. So with under 60% or so of households that are eligible for SNAP, the Supplemental Nutrition Assistance Program, they're missing out on a great benefit that can bring hundreds of dollars into their household income each month, and take pressure off. Similarly, we have older adults who qualify for Medicare and Medicaid, and they might be paying their Part B premium out of their Social Security check. By helping them get connected to the Medicare assistance programs, we're able to make sure that they don't have to pay that out of pocket. And so there are a lot of programs that people aren't taking advantage of, that by making those basic connections, we're able to help them have more financial security. And what we've seen is that's an important part of first engagement, but then second, it then reflects itself in people's ability to then pay more attention to their health.
Interesting. You've given a lot of examples. I'm going to ask you in a minute to kind of dive into some of these a little bit greater detail, but one of the things that's impressed me upon not just this conversation, but just learning about the center, is the breadth that you guys provide in terms of the different topics and issue areas. How are you coming to the decision points in terms of where and how to get engaged? Are you using kind of I got a hunch about this, or is there more of a data-based approach and decision analysis, or what's kind of behind the curtain, I guess, in terms of, or is it just like sticking the finger up and we're going to go this direction? But talk a little bit about the process, maybe.
Sure. I think in sometimes there's a bit of intuition. Sometimes there's a bit more evidence. So I think from we're a part of our UPMC Center for High Value Healthcare, sort of the center within the center, and that's really helps drive us both from an evaluation, but from a research standpoint. Secondly, what I would want to emphasize there is that we are looking to see where, some of these, sometimes there are national studies around how, for example, SNAP enrollment lowers overall cost of care for people with Medicaid. That, hasn't really been borne out on a health plan level. So we see those data and we've begun to test them. And so we're working on a study with our partner Benefits Data Trust, funded by the Robert Wood Johnson Foundation, to prove that very thing. And our early indications are that it does bear out. People that are continuously enrolled in this program have lower cost of care for whatever reason, and getting people enrolled seems to make a big difference in overall cost. Other places, I mean, maybe it's intuitive, but we as health plans, we're great at data, but we can become victims of our own data. So what we know comes often on a claim, and that doesn't tell me that you are living with an intellectual disability, that you either have a support system in place, through Medicaid or otherwise, or who the provider is or care manager is that is working with you in any number of community human services, whether it's children and youth, intellectual disabilities, aging, housing. And by making those connections, we see that members that are service connected, so to speak, do better. And it in some ways is obvious.
Both the family and the village that is required to make it happen.
For sure. And and for us to go in blind and not acknowledge that there are these other supports in place is not only inefficient, it just also doesn't meet people where they're at. So we found a great amount of success in partnering with community-based organizations and organizations in human services by helping each other accomplish our mutual health goals.
Interesting. Does it look different across the region? I mean, you have a pretty wide net as the health plan, but as you stretch across, you're from Punxsutawney, like as you stretch across Western Pennsylvania, do you see those connections at we'll call it the grassroots or community level, and those support networks being the same across the region, or are they a little bit different?
Oh, it can be highly variable, and sort of the rural-urban divide exists there. But even within our urban centers, there are limitations and differences in resources. So it really does take a community by community approach. I'm thinking about our efforts to expand our supportive housing program in Lawrence County, and our partner up there, LCAP, the local community action, they are soup to nuts doing many more things, and they have a resilience and they have a capability that is just because of there being fewer organizations and fewer resources, and that kind of and that makes them a really great partner for us. But in rural areas, of course, you're going to have to travel further, and those transportation barriers become more difficult. Interesting.
You had a couple of things that intrigued me too about this, and maybe just about you. You had this experience in government, and now have translated that into the business sector. I'm asking for a friend actually about this question, but how did your time in government kind of influence? Because you're rattling off a bunch of those organizations I know are a part of the state network of care. How has that experience in government helped you translate that into business?
Yeah, there are a lot of common threads and some differences as well, but I think you can make an impact in many different levels. And I started my career as a community organizer and advocacy, and working in a nonprofit where you're trying to influence things from the outside, in. Working in government, you're on the inside, but you're also dealing with the limitations and the constraints, and you're trying to really do the best you can with the resources you have, and try to advance policy to help do those things. Now, working in the private sector and working in healthcare specifically, we can be a lot closer to the ground. We are in a position to really help people and make a meaningful difference in their lives, and that is that really is something that is easy to inspire a shared vision around. And what I think about are sort of the arc of my career and skills, where there's that impulse to make a difference and to do good and to be a part of, making this world a better place. And, I've been able to achieve that, and sort of early in my career, seeing the issues is really what was most important to me. And then in government, taking on leadership roles and becoming deputy secretary and an acting secretary of an agency, and learning that empowering a team and people to make that change, helping them challenge a process, enabling them to act, right? Those are things that, can give you an even greater platform for change. And then sort of taking that full circle back to what we're able to do, around these issues, it's really applying those same skills, where I have a team where we are the center for social impact. We're not the center for good deeds. We are trying to make an impact, but also an impact that is sustainable and can grow. So if we're able to have a program that breaks even or better, we can then, scale it like we've done with supportive housing, or like we've been doing with, our workforce development efforts with our Pathways to Work program. We're currently seeing about 200 of our Medicaid members each month come to work somewhere in UPMC, and
inside the company itself,
within UPMC,
wow.
and so it's sort of the state Medicaid office put a requirement in place that managed care organizations like ours, UPMC for You, if an individual put their hand up and said, hey, I'm interested in some workforce supports, that we would help them. And generally that could be just a referral to the Career Link.
Sure.
What we've done in practice is we build our team of dream makers within our talent acquisition team, and they're there to help. Is
that like a Disney Imagineer, but just for UPMC?
Yeah, it's we're helping people on their career path, and many individuals,
awesome.
Many individuals with Medicaid are job ready, and most adults on Medicaid are able-bodied and working, one and often two jobs. And it's just sometimes those jobs aren't providing health benefits and a wage that can keep them off of, public programs. We can offer that within UPMC. We can help them get that career path started. And in other places where people need a little extra help, we have programs like our Freedom House 2.0, which is, in partnership locally with Partner for Work, and, looking to really take a trauma-informed approach to helping people from disadvantaged communities get their start in the healthcare world. And that started with our first 4 cohorts have graduated. All of those individuals coming out with an EMT certification. Wow. And sort of cross-trained in becoming a community health worker, and then getting plugged into various places in the healthcare community. So it's been a very successful program. We and we're really proud of it, but it's just a different way where you can make an impact.
That's amazing. I mean, because then you're taking these different verticals inside of UPMC, whether it's your HR team or different tools that you bring as a company, I'm going to say anyways, but then you're connecting them directly with the clients and service providers also to kind of triangulate that network together.
Yeah, and that's an incredibly important part of any type. You mentioned ESG, like any type of ESG effort by an organization, in order for it to be successful, needs to help meet some of those KPIs. It's got to be it's got to be a part of your culture. And so who are we as a community stakeholder and a part of our competencies? So we need talented people to fill these roles, and we have a pipeline of supports and programs, and who better than us to help support them come into health careers. And then a cause, and our cause is really improving the health of our community. So if we can do these things well together, what follows are hopefully better performance on governance. So, these same principles I was talking about, inspiring a shared vision, challenging the process, enabling people to act, sort of resonating, in that sort of governance space. On the social space, looking, how do we help people with housing? So we've been making community level investments in affordable housing, helping individuals experiencing homelessness or others navigating a very difficult issue that certainly we can't solve alone. And then on the governance space, being able to hire, invest, and where we buy things from and how we are a corporate citizen generally.
Link the whole supply chain together. You've mentioned housing a couple times. Just in the minutes that we have left here, I wanted to kind of dive into that quickly. In that, the home is the foundation for everybody, right? Like if you mentioned the issues and challenges of homelessness, the ability to create like a strong, healthy home environment, both through the social structures and family structures, but also in the physical investment in the house, has a lot of impacts on healthcare, whether that's indoor air quality or those other sorts of challenges. You guys have made some strategic investments in those areas and are looking to do more through a variety of partnerships. I know with organizations like the Urban Redevelopment Authority and Rebuilding Together. Maybe if you can share with the audience a little bit about that project and kind of what that means for the program.
Sure. Yeah. Thanks. Great question. So with our Homeward program, we are looking at the ways that we give, partner, and invest. And I mentioned some of the places where we're giving, but we have a long history of, through our charitable giving and tax credit giving to local community development corporations. We're working on the investment side. UPMC made a $50 million commitment last year to affordable housing and related supports in the region. A part of that is $15 million that we are putting forward in program-related investments to help accelerate, investment in affordability here in our community. So by making that type of flexible capital available, it can, help a tax credit project go, or other places where we've made some land donations. So working with Presbyterian Senior Care, looking to develop a LGBTQ-friendly development in Oakland, also through charitable giving, so investments in the new Second Street Commons, homeless shelter. But also, as you mentioned, sort of that home environment, if we spend 16 hours a day in that home, that air quality in that home environment, if there are mold issues or lead issues or other environmental issues, that's why we've also made investments in organizations like Rebuilding Together. So both, supporting them charitably, but also there are things that we do in our long-term care products, such as home modifications. So if an older adult needs a ramp or needs a more accessible bathroom in their home, we're able to help fund that and to make sure that home is accessible. Now, some of the things that we can't do are thought of as the obligation of the landlord or the homeowner. How do you fix that leaky roof that's rotted out the subfloor underneath the bathroom that you're looking at? And so by making these investments, in parallel, it can help power our, business imperative to help that person age in place, remain healthy, live a long, healthy life, and also have a complementary impact from what we're looking at charitably.
Wow, that's amazing. Just to wrap up here, one of the big things I've been interested in learning from you is, given all the work that you're doing through the center and with UPMC, and obviously we've been through a challenging couple years, which is probably an understatement, given the crisis of the pandemic, and which still has many lingering effects, and you never know, kind of, are we in pandemic, endemic, like those types of arguments that are kind of occurring now. What do you see, kind of going forward here in the future, for the center in terms of where some of your focuses are, and given the lessons that you've learned over the past couple of years, how are you looking to apply them going forward?
Yeah, I think as we've formulated our vision for what we do, we're really focused in on places where, by meeting a health-related social need, we can demonstrate an impact on health, quality, and cost. We've learned a few things. We've learned that oftentimes there are community-based organizations that our members know and trust, often better than they know and trust us. So how do we leverage those partnerships to help engage our members and help them on their healthcare journey? Secondly, getting people into supportive benefits can make a huge difference in stabilizing their financial situation, helping getting them access to services, and that we can see those improvements in health. We see work as a key social determinant. So how do we help our Medicaid members on their path to self-sufficiency and help meet employment needs that we face as an organization, and that getting people into safe, supportive housing is cost effective and works. And then lastly, how do we further our investments to use different levers to make an impact. So I see us applying those learnings in a more focused way. So looking at some specific communities where we see deep health disparities and seeing how we can better partner with community-based organizations, working with organizations like the Neighborhood Resilience Project and Footbridge for Families around our Matilda Tice Health Center in the Hill District. So how do we better connect our members in on a neighborhood level? Or how do we work further with organizations like Partner for Work to make strategic investments to develop a stronger workforce for healthcare?
That's awesome. This is terrific. I really appreciate you spending some time and sharing some great information with us, Ray. And a lot of things. This is like a deep breadth of information that's happening from the UPMC family, and specifically through the Center for Social Impact. So thanks for being with us today. I really appreciate it.
All right. Thanks for the opportunity, Grant.
This is terrific. Hey, thank you for listening in. I also want to thank our friends here at the Center for Media Innovation at Point Park University. I'm your host, Grant Ervin with S&B USA, and we're proud to be here with you today. And thanks for listening in, and we'll check you out next time. Have a great day.